See you, Nikki. Mrs.
Yes, Doctor, it's me again. I've had a relapse, several days ago, in fact, but I couldn't get an appointment because you're so busy, so in the end I came down myself, because now I'm worse than ever. The medication just isn't working. I think I'm allergic to it, and now my arthritis has started playing up again, on top of all the usual anxieties I have. My husband started drinking again, and the baby was throwing up all last week. Now Katie's come home from school with that new deadly virus that's going around, and John's sister Sue's going through that messy divorce, and she's giving me a lot of grief about that, and of course Katie's upset because she can't go swimming in the pool anymore because Sue's going to lose the house. And my dear old dad's gone into hospital, and Mum, bless, is doing the work for 3 people. She's doing the gardening and the cooking.
Good interview management is essential to good practice, and essential in any good practice. The doctor should set the agenda, focus on the patient's problem, and make a firm plan for treatment and for future consultations. Most practitioners fear that people with emotional disorders will act like this patient did and take up an inordinate amount of time. However, patients with emotional disorders want help and are usually on their best behaviour. Provided the doctor interviews properly, it's possible to define the problem and conduct treatment within the average consultation time of 12 minutes. The 4 demonstration interviews fit within that 12 minutes, even though much is done. These interviews presume that the doctor knows the patient and so does have background knowledge. One can't be this clever with new patients. Jill's stress-related depression is relieved by medication and problem solving. Managed differently, she could continue to regard herself as weak and unable to cope. Bob has avoided treatment for his severe depression for some years, but the doctor teaches him about the illness and the need for medication. Managed differently, he could well suicide. Sophie's panic attacks could progress to disabling agoraphobia if the doctor had not educated her about the nature of panic and the control of hyperventilation. Susan is often emotionally distressed, jumps to conclusions, and always imagines the worst. The psychologically aware doctor uses techniques of hyperventilation control and problem solving to deal with the current crisis. The interactive compact disc should enable clinicians to learn or refresh their knowledge of 5 basic clinical skills: good interviewing, good prescribing techniques, patient education strategies, structured problem solving, and hyperventilation control. You may choose how you proceed through the sequence.